Hello guys, we have a lot of dilemma and confusion about whether to use a syncrystallization for stabilization of implants in full mouth cases or otherwise the upper full arch or the lower full arch cases. Syncrystallization is needed if the prosthetic part is postponed for a longer period. Usually in basal implants, the concept is immediate functional loading, wherein after the placement of the implant, you go for the prosthetic part, wherein you can give temporization. I mean, the temporary crown can be given for a few months, or otherwise, if your implants are stable and if you have a good anchorage, you can go for a direct restoration. I mean, the direct functional loading processes can be given. Okay, so after the placement of the implants, many use the syncrystallizer to syncrystallize, means to connect all the implants in the arch so that all the implants will be stable and it will be in the proper position so that the implant will not have even the micro movements, so that will give good anchorage and stability for the implant. And also it will a good indication that if your implants are stable, your processes will be there for a longer period, means the patient will be fine with the processes for a longer period. So in my practice, I'm not using a syncrystallizer. Many of the dentists use syncrystallization for stabilization of the implants. So they will connect all the implants together through syncrystallizer. Okay, so that is through a technique of welding, the connecting all the implants together. But in my clinic, what I do follow is that, so instead of syncrystallization, even if it is a partially dentulous case of a bilateral posterior mixing or a 3-4 teeth missing where I have placed 4 or 5 implants, what I'm going to do is, after the placement of the implant, so I'll go for the putty impression. So I will give the impression coping analog and burnout to the lab fellow, so he is going to fabricate the zig trial. So I am going to fix the zig, so and a check for the excess implant or whatever, I'll trim that portion. So after that, what I'm going to do is I'll ask the person to fabricate the cast bar framework for that particular implants, whether I have placed a 3 or full arch or whatever. So he is going to give the framework, that is a cast bar framework. So what I do is I will just since I have done with the zig, so I will place the cast bar framework on the implants and I will check for the retention, I mean the stability, all those things. So after that, I'm going to fix that cast bar framework onto the implant with the help of any luting cement or the resin reinforced luting cement. Any cement will do. That should be good luting cement. That is the cement, your luting cement should be water repellent. It should not be water soluble kind of cement, because your cast bar will stay for longer period. So keep it in mind that your luting cement should be water repellent kind of, it should not be soluble kind of, water soluble kind of. Okay, I use a shofu and I use a GC also. Now I'm using resin reinforced luting cement. So uh, so I'm going to fix the cast bar directly in the patient mouth. Upon that, I will take another putty impression and send it to the lab, so that he is going to fabricate what do you call the rims for the rims he is going to prepare. Okay, so that's I'm going to through the articulator. So what I'm going to do with the rims is that is I'm going to do jar relation. After that, there will be trial, maybe the metal trial or bisque trial. So if everything is fine, I'll go for the there's a final processes. So why I'm telling this all these things is because I don't use syncrystallizer. What I'm going to do is the fabricated framework, the cast bar, I'm going to fix it on the patient's mouth, that is on the implants. So this cast bar fixation should be done as soon as possible, in the sense, since if the implants are placed maybe on the second day or the maximum by third day, you have to fix the cast bar, so that this cast bar, since it's going to hold the implants in particular position, it will give good stability. Okay, so the implant, since the crossbar has been fixed on the implants will not move, even the micro movements will not be there. So implant will be stable, and it will not be kind of the movement as well as the stability of the implant what you get while placing the implant will not change after fixing the crossbar onto the implant. Okay, so if you can follow this method, that is fixing of the crossbar framework, maybe on the second day or third day of the placement of the implant, it's going to retain those implants in that particular position only. So if you can do this kind of method, if you can follow this kind of method, no need of syncrystallization. It's not needed. Syncrystallization you are going to do only to stabilize all the implants, and to connect all the implants in a particular pattern, okay, to the occlusion, so that it will be stable for the longer time till you're going to give your processes. And even after that also it has to be stable. So that stability of the implant mainly depends on your primary stability, mainly depends on how good bone it's been engaged into, that is the D2 kind of bone. So we'll talk about the stability and anchorage in my next video. So I just wanted to discuss about the need of the syncrystallization, where I'm not going to use the syncrystallizer. I'm going to fix the cast bar directly into the implants. Then I'll go for the prosthetic part. Okay. So thank you. We will continue other discussions in the next video.